Okay, we're going to prepare a tooth to place a sealant today on this extracted tooth. And the first thing we'll have to do is recheck the surface to make sure that this is in fact the tooth that we are going to place the sealant. And we want to look at the deep pits and fissures and confirm that, yep, this is the tooth. So our first step would be to debride our tooth. We need to make sure that we have all biofilm removed from the occlusal surface, any plaque or debris, and in using a rotary brush on an RDH handpiece or a slow speed polisher, we're going to use dental pumice that's just wet with water, no fluoride, and use our overlapping strokes to clean off the occlusal aspect. Remembering to hold our instrument in a pen grasp using a fulcrum, and we're going to place our bristles right into those grooves, a little bit of pressure just to flex out those bristles, overlapping strokes to clean off the tooth surface on just the occlusal. We are just cleaning the occlusal surface to place a sealant. We are not polishing teeth at this point as dental assistants. That's a hygiene function. We just want to get into those grooves so when we acid etch this tooth and place the sealant, we have a nice mechanical chemical lock. Okay. After the tooth has been cleaned off the occlusal surface, we're going to take our air water syringe and rinse off the tooth of any pumice. Now, of course, when you do this in the mouth, we're going to be using a saliva ejector and an HVE tip to remove all of that debris that we are washing off. Okay, so we take a look at our tooth, and we see that it's nice and cleaned off. Little bit of air. Double check. And now isolate. We want to have 2 sets of cotton roll holders set up because the first step, we're going to isolate the tooth to place our acid etch, our phosphoric acid liquid, in this little well. And if you can see in this well, I have little sponges, applicator sponges, so we can place the liquid etchant on the occlusal surface. As you can see, this liquid etchant is seeping out a little bit, and I'm getting it on my gloves. Put about 3 drops in this well. And you want to be very, very careful that if you do get it on your gloves, you either rinse it or change your gloves. Once you have it on your gloves, this acid etch, you're not going to be able to see when you touch anything what you're getting the acid etch on. And if you happen to touch the patient's soft tissue, you will create a phosphoric acid burn. So you want to make sure that your gloves are nice and dry without any phosphoric acid. Now take your acid etchant sponge into your college pliers, pen grasp, fulcrum, and we're going to dab up and down into the grooves. We are not rubbing. Up and down to saturate the occlusal aspect. We want all that acid etch to run down deep into the grooves and not destroy the enamel rods. If you do go ahead and rub this, you're going to break the enamel rods. We're going to set our timer for 30 seconds. This is how long the acid etch will sit on the teeth. And in 30 seconds, we're going to rinse it off. You want to make sure you either have a second hand on your watch nearby or a timer, or yes, you could use your cell phone, but you need to have that present. And we're going to stop this at 30 seconds. And we'll rinse off the acid etch. Now, when you have this in the patient's mouth and you go to rinse off, you want to hold your HVE tip close to the acid etch, and as you rinse, suck up that acid. If this acid etchant gets on the gingiva, the tongue, the cheek, the lip, it will burn, so you want to be very careful with that. We're going to take that cotton roll off, come over to the sink again, and rinse. Water, just water. Okay, we're going to rinse off our acid etch, 30 seconds, and then dry with air. You want to keep your air water syringe tip about 2-3 inches away from the occlusal surface. Dry that for about 30 seconds. We're going to come over under the light and take a look. And what we're looking for is a nice etchant occlusal surface. It should be white and chalky appearance. And you may not see intraorally up at the cusp tips white and chalky, which is fine. We don't need to see that. We want to make sure that that acid etch went down into those grooves and etched inside the ridges, because that's where we want our sealant to flow. It's not important up here. We don't want sealant up here at all. So we're just going to take a nice little air stream and dry, and that looks really good. Take our new cotton roll holder with clean cotton rolls, dry cotton rolls, isolate the tooth again, and now we're prepared and we're ready to place our sealant. Important that we just place a little dot right in the center. Just a little dot, and you can see that white blob. Take your Explorer pen grasp and drag it through the ridges. Again, you don't want height here. You want this sealant material to flow down into the grooves and into the ridges, all the way down inside. Have an instructor check before you light cure to seal, and we're good to go. Okay, the next step is sealing the material. We're going to place our tip about 1 millimeter from the occlusal surface and seal this for 20 seconds. And when it's done, this will beep. That was 10. It counts down for you in the little LCD window. And we're almost at 20. There we go. Take our Explorer once again and take a nice feel. Make sure it's really slippery and hard, like glass. It feels like an ice skating rink. There's no soft material, it just is solid sealant. The next step would be to check our bite by articulating, making sure that this has no interference with the occlusion, and we're good to go. So we'll articulate and be finished. Okay, you want to have your articulating holder set up and place your articulating paper on top of the tooth. Have the patient bite down, making sure that we don't have any high spots. And if we do, doctor's going to have to come in and remove those high spots of sealant with a finishing burr, usually a number 4 or number 6 finishing burr. Take it right down. However, if you remembered after you place your sealant to take your Explorer and drag your material through, that usually doesn't happen. You'll end up having perfect occlusion and a wonderful long-lasting sealant.